This video will help you care for yourself at home after your thyroid surgery. Before you go home, your nurse will go over your discharge instructions with you and your caregiver. The information in this video explains those instructions so that you can review them while you're at home. This information is also written in the surgical guide your nurse gave you before surgery, called About Your Thyroid Surgery, which you can find on our website, www.mskcc.org/PE. After thyroid surgery, caring for your surgical cut, which is called your incision, is very important. Your incision may be closed with steri-strips, stitches, or staples. These will be removed at your first appointment after your surgery. If you go home with a bandage over your incision, your nurse will teach you how to care for it. If you don't go home with a drain, you can shower 2 days after your surgery. If you have a drain, you can shower 2 days after your drain is removed. When you're showering, you should let soap and water run over your incision. Gently pat your incision dry with a clean towel or washcloth after your shower. For the first 4 weeks after your surgery, don't tilt your head back or stretch your neck as if to look up at the ceiling. This will pull on your incision. It's okay to move your neck from side to side and up and down, as long as you don't feel any pain or pulling along your incision. You may feel tightness and numbness along your incision. This is normal as your incision is healing, and it will get better with time. You may need to take certain medications to replace the hormones that your thyroid used to make. You may also need to take calcium supplements if your calcium levels fall below normal. Before you go home, your surgeon or nurse will talk with you and your caregiver about the medications and supplements you'll need to take at home. You may be constipated after your surgery. Constipation is when you have fewer bowel movements than usual. Anesthesia, pain medications, and calcium supplements can cause constipation. Your surgeon or nurse may recommend you take a laxative or stool softener to help. You should also drink more liquids and eat more foods with fiber, such as fruits, vegetables, and whole grains. You should also go for walks as soon as you're able to. Walking is a great way to help relieve constipation. After your surgery, you need to avoid getting sunlight on your incision. Your surgeon or nurse will tell you when it's okay to apply sunscreen. This is usually when your incision has completely closed. For 2 weeks after your surgery, don't lift items heavier than 10 pounds, which is 4.5 kilograms, or do any strenuous activities, such as jogging or tennis. Talk with your surgeon about the activities you usually do and when you can start doing them again. Also, don't do upper body exercises with weights or machines for at least 4 weeks after your surgery. It's okay to do lower body exercises. Don't drive for at least 1 week or until it doesn't hurt to turn your head. Don't drive while you're taking any pain medication that can make you drowsy. Your nurse will call you a day or 2 after your surgery to see how you're doing and to answer your questions. If you have any questions before then, you can always call your surgeon's office. You can call anytime, but there are some reasons to call your surgeon's office right away. Call your surgeon right away if you have a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. New chills or chills that are getting worse. Increased bleeding from your incision. Shortness of breath or difficulty breathing. New or worsening swelling or redness around your incision. Or pain that doesn't get better with pain medication. You should also call your surgeon's office if you have new or increasing drainage from your incision. Numbness, twitching, or tingling around your mouth, fingertips, or toes. If you notice your heart is beating faster than usual, or if you have a new or worsening cough. Your surgeon or nurse will tell you if you need to report any other symptoms. If you have any questions about your thyroid surgery and recovery, you can find more resources on our website, www.mskcc.org/PE.